Hello, welcome. This is Peasy Pharmacology, and this video is about hypertension. So, first of all, I'll try to get into some basic blood pressure concepts and what is the hypertension pathophysiology. So that's the first one. Blood pressure concepts and hypertension pathophysiology. So on this one, we'll have the opportunity to look into factors that may have impact on the blood pressure and also see some notes on the diagnosis of hypertension. After understanding these basics, we can move into knowing which antihypertensive drugs are, so different classes of antihypertensive drugs. So we've got different classes of them. We've got ACE inhibitors, ARBs, calcium channel blockers, diuretics, beta blockers, and so on. So we'll first understand what are the main differences between them, what are the mechanism of actions for each class, what are the side effects, cautions to have with each drug. And after understanding these concepts, then we can move into understanding what are the clinical guidelines for the hypertension treatment. So clinical guidelines for the hypertension treatment. So we will see first of all like the general scenario. If you have a normal person with hypertension, what is the first class to try according to their age. You will see some like simple scenario, if that makes sense, but then further on stage 4 and 5 we'll understand that also these drug choices can change slightly according to other diseases that the patients may present, or also according to the fact they are part of a special population. So that's how we will end this learning process, is by understanding which drugs of choice or preferable drugs we have when concomitant diseases. So briefly we'll see that a patient with diabetes, their treatment of hypertension will be different to a patient that have a kidney problem or had a stroke or had a heart attack. So the first choices, they might change. And also we'll see that this choice can change also for special populations. So that's the plan. Let's go for it.